there, viewers! Rheumatoid arthritis causes inflammation and pain in the joints. It also causes problems in other parts of the body. But wait a second, how do you know if you're suffering from rheumatoid arthritis at its early stages? Well, this video will help you with exactly that. Can fatigue be a sign? How about dry eyes? Can you become depressed? We're talking about all that and more. Number 1. Fatigue. Before other symptoms kick in, a person with rheumatoid arthritis feels extremely tired and weak. This is fatigue. Studies show that up to 80% of people with rheumatoid arthritis have at least some feeling of fatigue, and more than 50% have high levels of exhaustion. Experts say that the feeling can be described as different from general tiredness. It's quite extreme and seems to emerge out of nowhere. In fact, fatigue can have a greater impact on your daily life than pain. Disease and high inflammation all lead to fatigue. Recent studies have shown that even when people are in clinical remission, they can still experience significant tiredness. How do you deal with everyday exhaustion? Share your tips and tricks with the Bestie community in the comments below. Number 2. Fever. Fever is one of those subtle arthritis symptoms you may miss or attribute to something else. Approximately 1/3 of people with rheumatoid arthritis exhibit total symptoms. Some patients describe these symptoms to be like the flu. If you have rheumatoid arthritis, your immune system is activated, but it attacks your body's own tissues, not a foreign invader like a virus or bacteria. This autoimmune reaction results in a mild fever. Number 3. Weight loss. We often celebrate weight loss as this admirable thing. The problem is, it's often a red flag. Weight loss can be due to hyperthyroidism, diabetes, cancer, and rheumatoid arthritis. Keep in mind that weight loss probably isn't your only clue for identifying rheumatoid arthritis. You also need to keep a check on sore or swollen joints, fatigue, and movement disorders. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Number 4. Joint warmth. As the blood flow from our capillaries widens, our joints feel warm to the touch. This warmth may be present whether the skin is reddish or not. Joint warmth can be a prominent sign of rheumatoid arthritis. Number 5. Joint swelling. Swollen hands and feet are a typical sign of rheumatoid arthritis. If the stiffness lasts for 6 weeks or more, it's time to talk to a doctor. Joint swelling becomes more noticeable as arthritis progresses, but even slight swelling can be an early sign. Inflammation and fluid accumulation lead to swollen and tender joints. If the feet are affected, people may find that they can't wear their dress shoes. Gloves or rings will also not fit. Your watches will feel too tight. Effective treatments for rheumatoid arthritis can stop joint swelling. It will also prevent joint damage. Number 6. Morning stiffness. This is so common, it's become one of the main signs to look out for. If the stiffness persists for an hour or more after waking up, it can be alarming. To some extent, morning stiffness affects most people with rheumatoid arthritis. It can last from a few minutes to 3 hours. The general stiffness makes waking and dressing difficult. Some people get up at least an hour in advance if they need to go out. After such a difficult start, everything else in your morning routine feels a lot harder. The reason is that at night, when your joints aren't moving, inflammatory substances can cause fluid to build up in and around the joint. This causes even more stiffness. The frustrating part is that exercise can help prevent and reduce symptoms, but it becomes impossible to work out. Number 7. Sweating. Heat tolerance and excessive sweating are also signs of rheumatoid arthritis. Remember how we talked about fever? Your body's immune response causes symptoms of mild fever and sweating as if it were attacking the flu virus. Number 8. Depression. Since rheumatoid arthritis is a chronic condition, it can lead to depression. It can have a huge impact on your daily life and function. The disease can slow you down and prevent you from doing what you love. This can lead to low self-esteem, frustration, and anger. But what's worse is that a person with rheumatoid arthritis will also feel sadness and hopelessness. This type of mood change is called reactive depression because it's a person's response to a particular situation. Before we move ahead, here's another video you might like. Watch and learn what happens to your body if you do push-ups every day. Number 9. Redness of joints. A change in the color around the joints of our hands and feet is also a confirmed sign of rheumatoid arthritis. Swollen joints can appear reddish because inflammation has caused the capillaries to widen. This causes more blood to flow to the area. Number 10. Joint tenderness. Rheumatoid arthritis is not only a disease of the bones and joints, it also affects tissues throughout the body, damaging blood vessels, nerves, and tendons. Hand and foot deformities are the most obvious signs of rheumatoid arthritis. When you place pressure on your hand, the joint in the middle of the fingers will feel tender. The joints at the base of the toes may also feel this way. This soreness can be very uncomfortable. Number 11. Dry eyes. The most common eye-related symptom of rheumatoid arthritis is dryness. Dry eyes are prone to infection. If left untreated, they can damage your cornea. Dry eyes can also lead to Sjogren's syndrome, an autoimmune disease associated with rheumatoid arthritis. While it is rare, rheumatoid arthritis can also cause inflammation of the white portion of your eyes. This will cause redness and pain. If you have rheumatoid arthritis and eye pain, blurred vision, or other eye problems, see a doctor right away. Early treatment can help prevent it from getting worse. Number 12. Joint pain. Pain is the main issue for people with rheumatoid arthritis. Joint pain is distressing and has an impact on both your physical and mental state. Rheumatoid arthritis pain can be due to joint inflammation and is also enhanced by structural damage to the joints. Rheumatoid arthritis can occur at any age, but usually occurs between the ages of 30 and 60. It affects women more than men. The severity of rheumatoid arthritis can vary from person to person, and symptoms change every day. Sometimes the symptoms, such as joint pain, may become more intense. The pain flare-ups are unpredictable and can appear out of nowhere. Rheumatoid arthritis can affect a single area of the body or multiple areas. These include fingers, wrists, elbows, shoulders, knees, hips, ankles, toes, feet, neck, shoulders, and even jaws. Usually, small joints are affected at the early stages of the illness. Number 13. Joint pain symmetry. Confused? In rheumatoid arthritis, when pain is felt in one joint on the side of your body, it's also felt in the same joint on the opposite side. This is known as joint pain symmetry. The difference is that the degree of pain can be different on one side and the disease progression can vary. However, when only a few joints are affected, the disease might not show symmetry. Rheumatoid arthritis affects large and small joints on both sides of the body. This includes both hands, wrists, elbows, and the balls of your feet. Number 14. Lung problems. In addition to the joints, rheumatoid arthritis affects other parts of the body, including the lungs, skin, digestive system, heart, and blood vessels. Lung complications associated with this chronic disease are the second most common symptoms after the joints. Almost 1 in every 10 people with rheumatoid arthritis develop lung complications at some point. This is just as dangerous as heart failure. Occasionally, lung problems occur before joint inflammation and pain in rheumatoid arthritis. Male smokers between the ages of 50 and 60 with severe rheumatoid arthritis have a much higher chance of developing a lung disease. If you have rheumatoid arthritis and unexplained breathing problems, see your doctor right away. Number 15. Tingling and numbness. Unfortunately, rheumatoid arthritis is something difficult to spot and diagnose as symptoms vary from person to person. What makes it worse is there is no actual test for the disease. The feeling of numbness and tingling can happen because joint inflammation causes nerve compression and loss of feeling. Number 16. Difficulty carrying out everyday activities. The combination of joint pain, stiffness, and fatigue can make it difficult to perform basic tasks. This loss of function can be extremely frustrating. It's hard to bend, hold a toothbrush, do up buttons, and even pull up a zipper. Not being able to function normally leads people to the doctor's office. About 40% of people with rheumatoid arthritis experience signs and symptoms that do not affect the joints. With time, rheumatoid arthritis can cause them to deform and slip. Rheumatoid arthritis is a lifelong disease. When treated properly, it may go away for a while, but it usually comes back. It's important that you see your doctor as soon as symptoms appear. The earlier you start treatment, the better your result will be. Some of the damage caused by RA is irreversible, so finding the disease and treating it early is very important. Check out 10 foods to avoid if you have arthritis. You can also try 7 exercises that make your knee arthritis go away. Go ahead, click one, or better yet, watch both and learn more about how to deal with arthritis. Do you struggle with rheumatoid arthritis? Let us know in the comments below.